I guess to me, safety at work is being able to come to an environment where you know that the patients are going to be safe and that you are also going to go home without injury, and your colleagues as well.
Safety is incredibly important because you are not only looking after the patient, but you're looking after yourself and your fellow workers.
Work health safety means to me that I can go home injury-free every day, safely to my home.
Work safety is about protection and the expectation that management will act on issues when we report them.
In health, as in other industries, we have seen many changes in recent years. Advances in technology, new drugs and procedures, and new ways of providing higher levels of care even in a patient's own home. These changes all present challenges for those managing and providing care, not least for their impact on health and safety. So it was time for a new approach to national consistent work health and safety laws, which has resulted in new legislation in New South Wales. The New South Wales Work Health and Safety Act, which came into force from the 1st of January 2012. The purpose of this presentation is to provide an introduction to this legislation, highlight the key features, and alert you to how occupational health and safety, or work health and safety as it is now known, can help deliver a safer workplace for all. There are 3 presentations in this series. The first designed for all nurses and midwives, with subsequent presentations for nurses and midwives in supervisor, manager and executive roles. The presentations are supported by a guidebook entitled WHS Essentials for Nurses and Midwives, which provides an invaluable resource for anyone working in the health, aged care or community sectors. The Association acknowledges the support of WorkCover New South Wales in providing funding for these resources and trusts you find them useful guides for you and your colleagues' safety at work.
The New South Wales Work Health and Safety Act was introduced in January 2012, providing consistent WHS legislation across Australia. The WHS Act provides the framework for protecting the health, safety and welfare of everyone at the workplace. It outlines who has a duty under the Act and their responsibilities. It defines specific obligations such as risk management, consultation and worker education on WHS, and it provides for compliance and enforcement. The WHS regulation provides the detail on how the duties prescribed under the WHS Act must be performed. Practical advice on specific aspects of the legislation can be found in the codes of practice and guidelines, many of which are relevant to the work of nurses and midwives. The term employer has been replaced by the person conducting the business or undertaking, or PCBU. The PCBU can be an organisation such as a hospital, aged care organisation, nursing agency or university. Or it can be an individual, such as a partner in a medical practice or someone who engages a nurse or midwife privately. The PCBU is the principal duty holder and must ensure, as far as is reasonably practicable, that the workplace does not expose workers and others to health and safety risks. This duty is not limited to employees. It applies to any worker whose work is influenced or directed by the PCBU, such as agency personnel and contractors. It also applies to patients and visitors. The duties required of the PCBU are comprehensive and include ensuring that the work environment is safe, including buildings, equipment and effective emergency and security systems, ensuring that the systems of work are safe. This includes providing sufficient workers with the right skill mix or access to the right equipment, providing information and training on how to work safely, providing supervision, establishing and maintaining effective worker participation in WHS, including consultation and issue resolution procedures, providing facilities for workers' welfare, such as meal rooms and lockers, monitoring workplace conditions and worker health, such as exposure to radiation and certain chemicals, notifying WorkCover New South Wales of certain incidents, and establishing effective dialogue with other PCBUs that work at the workplace, such as New South Wales Ambulance, agencies, TAFEs and universities. Everything required to fulfil these responsibilities must be provided by the PCBU without cost to the workers. Reasonably practicable is the standard for the PCBU to comply with its obligations under the WHS Act. It means that the PCBU must take all reasonable steps to manage WHS issues. It's a balance between what is known about the risk and the ways to eliminate or control this risk, the time and effort involved, and, after all other considerations, whether the cost is disproportionate to the risk.
We use SlideSeat as a manual handling aid. There was a problem that staff were not using it, and when we asked them why they're not using it, and they said that it's hard to find in the residence room and it's hard to reach when they're trying to use the SlideSeat. And we bought a few containers, and what we did, we put the containers behind the bed, so that way staff can reach easily whenever they need to use it. So now they are using it, and we don't have that problem anymore.
Officers of the PCBU are charged with ensuring the PCBU complies with its duties under the WHS Act. A separate presentation in this series deals with the responsibilities of officers. While the primary duty for WHS lies with the PCBU, as a worker you also have responsibilities, specifically taking reasonable care of your own health and safety, taking care not to put others at risk by anything you do or don't do, complying with reasonable instruction, and, once advised and trained, cooperating with WHS policies and procedures. In practice, this means participating in training on policies, practices and WHS issues, following safe work practices such as wearing protection when handling waste, wearing duress alarms and complying with safe patient handling requirements, reporting hazards, incidents and unsafe practices, reporting and removing faulty equipment such as a trolley with a damaged wheel, and, if it is within your expertise and safe, correct unsafe situations like a spill on the floor. Situations such as hazardous tasks, new equipment, or changes to work or the environment will require evaluation. This is known as risk assessment. Risk assessment is the responsibility of the PCBU and involves several people, usually with a trained or experienced person leading. If you get the opportunity, it can be a valuable experience, as worker input is essential for ensuring a safer workplace. As a worker, you have some responsibility to your colleagues for their safety and well-being at work. What might seem a small thing at the time, such as not reporting a fault or near-miss incident, or not returning equipment to a charger, can have a significant safety impact on your colleagues working subsequent shifts. Unfortunately, bullying is still an issue in some workplaces, compromising the health and well-being of the recipient. No nurse or midwife should ever participate in this unacceptable behaviour. Don't condone the behaviour by ignoring it or thinking it isn't your problem. Follow your organisation's procedure and support any person being bullied. The association can also provide support to anyone being bullied at work. You should also be aware that along with your WHS responsibilities comes the right to cease or refuse to carry out work which you believe is unsafe if it exposes you to an immediate or imminent risk, such as working with faulty equipment. Once notified, your supervisor should assign you to other work while the situation is remedied. Balancing care needs, patient wishes and staff safety can sometimes be difficult, but the WHS legislation is clear. Patients and visitors have responsibilities not to place workers at risk. It is unacceptable to refuse to cooperate with any safety direction, make unreasonable demands or bully workers. Patients and visitors are also accountable for any criminal behaviours, such as assaulting or threatening workers or interfering with safety equipment. You need to be aware that for all duty holders, including individual workers, there are penalties for non-compliance with the legislation. The penalty for a worker can be up to $50,000 for the lowest category offence. For higher category offences, such as reckless conduct, penalties can be up to $300,000 and can also include a prison sentence. Consultation provides all workers, not just employees, with a voice on WHS issues in the workplace. It's a key requirement of the legislation, particularly when identifying, assessing, eliminating or controlling risks. Most organisations have well-established health and safety committees. These committees are important for dealing with organisation-wide issues such as developing WHS policies and monitoring the effectiveness of strategies that address WHS issues.
As a health and safety representative, it means that I'm quite important on the ward because I have to attend those meetings. I need to inform the committee if there's any issues that can't be addressed on the ward, and vice versa. I need to let my colleagues on the ward know if there's any important issues coming out of that meeting.
For dealing with local WHS issues, health and safety representatives, or HSRs, are recommended. An HSR is elected to represent workers in a work group, which is a group of workers who perform similar functions or work in defined areas. HSRs have a number of functions, but essentially they represent workers and negotiate with local management on WHS issues. You should report a WHS issue directly to your supervisor or manager and give them the opportunity to fix it. However, if it's not resolved in a timely way, you should refer the issue to your HSR. HSRs and their deputies are elected for 3-year terms and have certain powers, which include directing unsafe work to cease, issuing notices to correct anything that is unsafe, and requesting assistance. Assistance may come from WHS professionals, WorkCover, or the WHS professional officers from the association. To fully understand the role and be able to execute all prescribed powers, HSRs must undergo training, which is 5 days initially and then an annual refresher of 1 day. If you're elected as an HSR, you'll need to request the training if it's not offered by your organisation. The association believes the best WHS outcomes will be achieved with both HSCs and HSRs. Other arrangements are possible, so all workers need to be involved in determining the best participation approach for your workplace. You can invite the association to be part of this process. The association hopes you have found this presentation a useful introduction to the Work, Health and Safety Act. More detail is provided in WHS Essentials for Nurses and Midwives, along with best practice examples specific to your work. The guide also includes a comprehensive list of WHS resources for you to explore. Further advice about the WHS legislation and how it affects you can be obtained from your union delegate or directly from one of the WHS professional officers at the association. For nurses and midwives who hold supervisor, manager and executive roles, we invite you to view the other presentations in this series for an overview of responsibilities relevant to your role.
I guess because I'm just starting out in my career, I guess it is important that I can be in this profession for a long time, and there are risks. So I guess that knowing that the workplace has the right policies and procedures to deal with things like that, so that I can work as long as I can.
Work, health and safety, it's a part of our culture, it's the way we work all the time.
You don't want to come to work and not feel secure in what you're doing and in the environment that you work in. So, I think it just makes for a happier work environment, and the job gets done with a smile on everyone's face.